Having a fever? Take paracetamol. Hey, you have backache? I also have it. Let me recommend you this medication that I bought earlier. It's very effective. Sounds familiar? This is something that we hear and say very often. In fact, in a study in Malaysia that involved 364 participants showed that up to 83.9% of the participants take over-the-counter medications, while 82% of them have little to moderate knowledge regarding over-the-counter medication. Hi, my name is Zian, a registered pharmacist from Klinik Kesihatan Sungai Bakap, and today I'll be sharing with you about self-medication. Self-medication is defined as the obtainment and consumption of drugs without the advice of a healthcare professional, either for diagnosis, prescription, or a surveillance of the treatment. Before we dive deep into the topic of self-medication, allow me to introduce a few terms for ease of understanding. Medicines or drugs can actually be broadly classified as prescription drugs and non-prescription drugs. A prescribed medication is a medication that you can have it only if the doctor has given a prescription for it. For example, antibiotics and antihypertensives. Whereas for non-prescribed medication, they are medication that you can buy it over the counter through a retail pharmacy store. For example, cough and cold medication and certain pain relievers. Non-prescribed medication are sometimes known as OTC drugs or over-the-counter drugs. Another study done in Malaysia in 2011 showed that 75% of the respondents had used OTC drugs at least once in their lifetime. And the most common OTC drugs include analgesics or pain relievers, antipyretics, antibiotics, cough remedies, and supplements. Based on a cross-sectional study on self-medication behavior among the urban population in Malaysia published by the Faculty of Pharmacy, University Technology MARA, 83.8% would search for information before practicing self-medication. Modern healthcare professionals and internet were the most common source of information about drugs for self-medication. Well, the main reason for self-medication is that the illness is often perceived as something minor by the patient. In fact, for some uncomplicated cases, say an acute headache as a result of a lack of sleep in a healthy individual, sometimes buying a strip of paracetamol from the nearby pharmacy store can be a more convenient choice compared to waiting in line to see the doctor. Self-medication undeniably, when done correctly, with proper guidance, also offers patients an increased access to medication, saves time, and they get involved to play a more important role to their own health. While self-medication can be convenient for many people, let me also remind you that self-medication may potentially be dangerous and may lead to certain serious consequences. Well, allow me to share some of them. Many diseases share common symptoms. Take for example, dizziness. It can be due to inner ear disturbances, motion sickness, but in some cases, it is because of an abnormally low blood sugar level, blood pressure, or even anemia. With the internet being more and more easily accessible nowadays, many people turn to Mr. Google instead of actual licensed healthcare professional for medical advice. Now, don't get me wrong here. I think being able to learn extra knowledge will be good for everyone. But a delayed treatment as a result of an incorrect self-diagnosis may pose a much larger harm to patients and cause you even greater. Have you ever heard or met someone who has a certain medical symptom for some time but refuses to go for a proper medical examination only to find out later that he or she is diagnosed with late-stage cancer? While some may think that taking medication to alleviate symptoms is beneficial, But treatment of non-specific minor symptoms with over-the-counter medication can sometimes mask a severe underlying disease. Without medical guidance, an undiagnosed medical condition may worsen over time and cause even more severe symptoms or complications. There are also another group of patients who's always in denial when diagnosed with a disease. Doctor, I don't want to inject insulin first, can I know this herb that my friend recommend me, very powerful. His uncle get cured of diabetes without taking insulin, without taking medicine in 3 months. Hello? Trust me, if there's a better, safer, and clinically proven and a more cost-effective alternative, we would have not hesitated to apply it on our medical practice. Apart from misdiagnosing your condition, when you take a medication without consulting a doctor or a medical professional, you might unknowingly take the wrong drug or possibly an incorrect dose. This should not be taken lightly, as taking too much dose may lead to a potential overdose and harmful side effects, while a lower dose may cause the drug to be ineffective. Take for example, there is this patient, a 53-year-old man, who used to have recurrent headaches. He got into a habit of popping paracetamol frequently without medical advice, believing that it helps treating his condition. But after some time, he felt weak. He has a history of mild liver disease, and he did not know that paracetamol should be avoided if you have chronic liver disease. Well, sadly, the patient soon developed severe liver disease and died. Well, my third point, addiction and abuse. Just like alcohol, tobacco smoke, and other abusive substances, addiction happens when you take a drug that is meant to be or meant to treat an acute condition for a prolonged period. Your body may become dependent on a substance to continue functioning correctly. For example, prolonged use of opioid analgesics and certain sedatives. This may lead to potential abuse, as you might be continuing the drug longer than necessary. Another specific issue that I'd like to highlight here today is about self-medication of antibiotics. It happens when you take antibiotics without first consulting a medical doctor, or by using leftover antibiotics from previous treatment, or by getting antibiotics from a nearby pharmacy store without prescription. Antibiotic overuse and misuse is fairly common in our society. I often see parents buying cough and cold syrup for their children for symptom relief, but there are some drugs, for example antibiotics, should not be taken without a doctor's consent. For example, if a person has got tonsillitis or a throat infection, it could be viral or bacterial. For viral causes, it doesn't need any antibiotics. But if a patient feels that he can take medication himself and proceeds to take antibiotics, this is not a rational use of antibiotics, and rather it is a misuse of the drug. It may not seem to be a great issue, but the misuse and overuse of antibiotics can allow bacteria to be resistant to these medications, meaning that antibiotics can no longer be effective against these microbes. Imagine that one day, when you woke up with a bacterial infection and none of the antibiotics available we have is effective against the bacteria. By then, we will have great issues. In fact, it takes years or even decades for scientists to develop a new antibiotic. Well, much has been discussed and said about the topic of self-medication. If I were to conclude this topic in one sentence, it would be: self-medication can sometimes be convenient and time-consuming, but when in doubt, please do not hesitate to seek medical advice from medical professionals.